Well, thank you very much for coming. Good afternoon. It's great to be here today to provide details on our new public health legislation, an act respecting the protection and promotion of public health. The new act being debated today will modernise public health in Newfoundland and Labrador, and it will make our legislation amongst the best in Canada. We've taken the best approaches, concepts and language from more recent public health legislation across Canada and around the world. We have adopted best practices that are in place and effectively working in other provinces and territories. More importantly, the Act was brought about by listening to the voices within our own healthcare sector and our communities right here at home. The Department held a series of consultations earlier this year to inform the drafting. A public health forum was held with regional health authorities and other partners, including the Public Health Agency of Canada. There were one-on-one engagement sessions with stakeholders and community partners, and the public was invited to provide input through an online questionnaire on Engage NL. And I'd like to take the opportunity to recognise one key group that was particularly influential, the Newfoundland and Labrador Public Health Association. They wrote to us with many of their ideas, participated in our engagement sessions, and came in to meet with me, not to mention meeting with other department officials on a number of occasions. Their ideas were very helpful in the development of this landmark legislation. I hope that they're as proud of it today as I am. We're bringing forward a new piece of legislation that has considered a wide variety of individual, community and population health issues. An act respecting the protection and promotion of public health will enable us to address gaps in the existing legislation. Some of that was enacted over 50 years ago. The Act focuses on the 5 main functions of modern public health. It talks about health surveillance. That's the monitoring of trends in diseases or injuries and the taking of appropriate action. And you may recall things like the outbreak of syphilis in the Avalon Peninsula last year would be addressed under this heading. Population health assessment, which provides a greater understanding of the health of certain populations with the aim of better services, programs and public health policy. And that would, for example, relate to our links with helping Indigenous communities in discovering their needs and what they'd like from their population health. It talks of disease and injury prevention, minimising or eliminating the impacts of disease and injury. So that would speak to things like childhood immunisations to reduce measles or polio, or screening for sexually transmitted and bloodborne infections like hepatitis C or HIV. It will also talk about health promotion, the promotion of healthy lifestyle choices, such as healthy eating campaigns, our smoking cessation program, wearing bicycle helmets and seatbelts, things like that. It also speaks of health protection, which is assuring health and safety to control the spread of infectious diseases, to protect from environmental threats, and to ensure emergency preparedness. Those are kind of the more traditional roles associated with public health. But the new legislation in this province will help the public health workforce respond quickly to emerging challenges, like the potential for fast-moving infectious diseases. We're all familiar with the emergence of SARS a number of years ago, and more recently Ebola, which caused a worldwide public health emergency. Closer to home, we're all familiar with the incidence of tuberculosis in Nain over the past year. Just last week, the Nunatziavut Department of Health and Social Development and Labrador Grenfell launched a campaign at encouraging those residents of Nain who have yet to do so to get screened for tuberculosis. Senior officials in my department, including the Chief Medical Officer of Health, have been integral in planning this community screening in collaboration with our partners in Nunatziavut as well as Indigenous Services Canada. The Act clearly identifies roles and responsibilities of everyone under these circumstances. Myself as Minister, the roles of public health officials, including the Chief Medical Officer of Health, Regional Medical Officers of Health, and Environmental Health Officers. The Act provides the authority for public health officials to issue orders to curb the spread of disease or manage an emerging public health event. For example, you will remember the H1N1 pandemic faced by this province, the country and indeed the world in 2009. But this new legislation provides a modern, constitutionally sound framework for the management of such an event. While we are ready for such an event today, this new framework will enhance that preparedness while ensuring the rights of all concerned. It gives the Chief Medical Officer of Health authority to create and monitor the implementation of core public health programs and services, such as our childhood vaccination program or our preschool screening program. This new legislation delivers on the commitment in the way forward to deliver better services and outcomes for residents. It implements Action 1.29 in the way forward, which saw government adopt a health in all policies approach. This approach is a modern public health tool that has gained prominence due to the recognition that complex problems in the health sector are linked to the social determinants of health, things like education, employment, housing, and poverty. I'm proud to say that Newfoundland and Labrador is only the second province in Canada to reference this approach, specifically in its public health legislation, putting our province at the forefront of public health innovation. A strong public health system has significant impact on the economy. It supports a healthy workforce. It helps ensure continued capacity in our acute care services. It results in the improved health of the population and a reduced need for healthcare services. In short, the health and well-being of our population impacts the province's economic potential and sustainability and makes an important contribution overall to economic progress. This Act will drive improvements in the delivery of public health programs. These in turn will improve the health of our communities and our population as a whole. And finally, as Minister, I'm truly proud to introduce this legislation. It is a hallmark in public health policy development for our province, and I would suggest in Canada. It provides for the legislative and regulatory powers to make it work. Thank you very much.